So over the past 40 years, the industry as a whole has made incredible steps. We've gone from treating symptoms to understanding the underlying cause of disease, treating or even changing the underlying cause of disease. And so you've seen death sentences like HIV was in the 80s turn into a manageable disease. We've even seen the very first cures for hepatitis C, which was unthinkable of 40 years ago, and an increased survival rate for cancer patients. Now 2 out of 3 live more than 5 years. So really incredible breakthroughs, even in the way we've treated, in the way we manage the disease, in the way we deliver our medicines, enormous strides, and it looks very exciting for the future. Looking into the future, I think the 3 main challenges can be summarized in one. Because of the breakthrough science that we're developing that now goes into the molecular level and completely changes the outlook of medicine, if you like, with these cures or with treatments with people's own cells, managing to introduce those incredible techniques into healthcare systems is a challenge in itself. I think it's our biggest challenge, and we need to work together with all the stakeholders in the healthcare system, all the way down to the patient, to make sure that we introduce that in the best way possible and that products get to patients as quickly as possible. Bringing the patient to the center of all the conversations around developing treatments can only be beneficial, because the patient knows what he or she needs at the end of the day. At EFPIA, we've started to include patient engagement into everything we do, and we've also developed a couple of guides for our members to help them collaborate better with patients at different stages of the medicine development. So We Won't Rest was really created as a platform to allow our members to tell their stories, from the lab technician all the way to the CEO, explain why he or she is involved in our industry, what their objectives are, and why they won't rest. Because we realize that illness never sleeps, and neither do the people who work to fight that illness. And it responds a little bit to that vacuum of communication that perhaps we had, thinking that our products are clearly beneficial and we didn't have to explain why or how. And it's very exciting to see the movement now. It's been translated in more than 20 languages in just 1 year. It's present in more than 30 countries, not just Europe but even beyond, and it's been seen by 40 million people. So it's really encouraging to see that not only are people listening, but we also have a lot of input to give, and material and information to share. I think we have great opportunities and challenges at the same time. So we have this incredible science happening, and both in biology, so if you go all the way down to biotechnology and microbiology, and also around data and IT. And these are 2 revolutions, very silent but existing revolutions, and we need to get the most out of these for the benefit of the patient. And if you like, the biological one is a bit of a Mexican wave throughout the healthcare system. It starts with us, and it sort of goes all down the system, hospitals, doctors. It changes the way we all do things. Data is the other way around. With data, we collect information all the way from the patients all the way back, and it can inform every different step, including research. And we need to manage to integrate these 2 revolutions into the system in order to optimize everything. Optimize research, optimize development, optimize delivery, optimize expenditure of the whole system. And I think that'll be our challenge, and we can't do it alone. And so as EFPIA, we really want to work in partnership with everybody else in the healthcare system to make it happen for the patient. I think that the crisis was helpful in a way, because as every crisis, it focuses the mind, and people realize what they need to deal with. And I think that it came at a time where the science is just exploding. And so it's forcing all of us in the healthcare system to think more creatively out of the box, but most of all, to speak to each other, because it's not something that maybe in the healthcare space has been done very much. The different players in the healthcare system haven't necessarily worked together. And now we're all disrupting each other. So we need to talk. And we have the same objective, getting the product to the patient quickly.